Good morning. I'd like to call the meeting to order. First item on the agenda is to review and approve the minutes from the July, what was it?
21st?
21st meeting.
Motion to approve.
Do I have a second?
Yes, second.
Dr. Aber?
Aye.
Aye.
So approved. Next item on the agenda is to review and discuss COVID-19 updates.
Good morning to the chair. This is Solo Dennis from the city of Worcester. At this time, I will ask my colleague, Ms. Amelia Halton, to give an update on the COVID-19 update, but also the listeria, the outbreak at the senior center in the town.
Good morning, everyone. This is Amelia. First, let me just go over Shrewsbury Nursing Home had an outbreak, a COVID outbreak, and they started with back the end of July, 10 positive staff and 15 positive residents that were tested by that time. So this went through the state, and the state reaches out to us to help out. But the director there knows what she's doing, and she goes through this periodically, so she knows what guidance to follow. She's in touch with us. She's in touch with the state. And currently, at this point, they just recently had one resident pass away. He did have COVID, but we are not sure of the cause of death at this point in time. And there aren't any positive cases today. So that's the nursing home, and those were all COVID cases. In terms of communicable diseases in the past month, influenza and COVID were the only one that showed up in Maven that are worth talking about. There have been about 17 COVID cases, not including the cluster outbreak. In terms of COVID vaccine, we are still waiting to hear from the state when we are eligible to purchase the new formulation so that we can start discussing when and where to have clinics. But I know that I will have access to flu for children, and that'll be coming up in the next month or two, where I can actually order it and make plans with the schools. So that's it in terms of communicable diseases and vaccines from our end.
Thank you very much. Dr. Abraham.
Amelia, a couple of questions. First, on the Shrewsbury Nursing Home, so was the index case a patient or an employee? And what mitigation measures are they doing now?
So, a patient, a resident,
Okay.
and they do what they always do. They isolate anyone who is considered positive. They ensure staff that are positive follow their strict regulations that they have worked out with the state. They clean all the high-touch areas. They disinfect daily. They do what they're supposed to do. Everyone wears a mask. It's just, if you have a visitor, sometimes that cannot be controlled. They're doing the best that they can, and they're doing what's recommended by the state.
Okay. I have a couple of questions also on the confirmed communicable disease report for Shrewsbury that you had sent out, that you had shared with the board. I noticed on that one of the diagnoses was tuberculosis, and there were 46 cases. These are active, confirmed tuberculosis, or does this include latent tuberculosis?
It includes everything. It includes the cases that the state follows up with that we don't need to follow up with. They put everything in Maven. And so when we do these reports, it's hard to tweeze out what we're actively following up on and what the state is.
But isn't that problematic in terms of attribution of the disease? Because if you put a diagnosis of tuberculosis, one assumes this is active tuberculosis. 46 is a high prevalence community, which would make us a very high prevalence for the denominator, which is the population of the town. And latent tuberculosis is really not tuberculosis at all. So wouldn't it behoove us to sort of break that down to really understand what the extent of the disease burden is of actual tuberculosis?
Yes, you're exactly right. And currently, we don't have any TB cases that we are managing in Shrewsbury. And I will have that breakdown next time of exactly what we are involved with and what the state is involved with, because the report is misleading.
Right, that'd be great, because we could even just put an asterisk if you have no control over the graph per se, then just an asterisk, and to qualify that tuberculosis as being latent tuberculosis, which is a whole different animal. The other category I saw on that was a refugee family. Is that a diagnosis, or is that a communicable disease of some sort?
I don't know why it's on there like that, and I need to clarify that. We do get refugee families in Shrewsbury, and that needs to be broken down further. I'm not, I'm in the middle.
It's not a
of
medical
finding
diagnosis.
out.
Exactly. Yeah, I have issues
Yeah,
with...
that's not a diagnosis.
Correct. I have issues with labeling a refugee family as a communicable disease. So I think that's problematic, both in terms of diagnostics as well as attribution. It could appear as we are being pejorative in some fashion. I think being a refugee family doesn't necessarily imply that they are infectious. I'd much rather the attribution of the actual disease, if there is one, rather than the, quote, refugee status, which is really a socioeconomic determinant.
Right, and it's inappropriate to do it that way, so.
And did that come out of Maven?
Yeah, this is all from Maven, so I put a call into one of the EPIs to discuss this, so hopefully we can discuss this between today and Monday, or they can show me a different way to run the report. But that's,
And
that's a point of contention for sure.
agree. Thank you for following that up, and please convey our Board of Health's concern about the attribution as well, because if this is shared publicly, this would really be poor attribution of causes, so it would be problematic. Thank you for
Right,
thank you for your good work.
Absolutely.
Just from a COVID update standpoint, both institutions, UMass and St. Vincent Hospital in Worcester, have seen a tripling of COVID cases. And so we actually yesterday went to a masking mandate in the hospital, so that all clinical areas, we are all going to be masked, including visitors as well as employees and physicians and allied practice clinicians will all be masked because of the surge in cases that we have seen, whether it's a temporary blip or whether this will be a harbinger of a more sustained response is unknown at this time. Potential hypotheses behind why we are seeing a surge include with inclement weather, people tending to be more indoors, and so therefore there seems to be some clustering around that. And the other fact is we're about a year out of the bivalent booster, and so this is around the time when immunity wanes, so we've sort of seen a waning of both herd immunity as well as vaccine-based immunity, and so this may be reflective of that. However, while this may be temporary, the more worrisome aspect is if we're already seeing a little bit of a clustering now from just people being indoors, Then come winter, we're going to see a little bit of a surge again. And so the timing of the next booster, which is expected sometime next month, is critical. Also of concern is that there's flu vaccine going to be coming out. There are 2 RSV vaccines which have been approved. So essentially we're asking the public to take 3 different vaccines for this year, at least for the folks who are at risk for RSV, standard seasonal flu, and obviously the new COVID variant, COVID booster. There is the new most of the cases now seem to be the new variant, which is the EG.5 or EG.1.5, which is a variant of Omicron. There's a double mutation in the spike, so there's a little bit of speculation as to whether the vaccine, which was developed before this particular variant came out, and what its efficacy is. But there's reasonable confidence, again, that since this was designed towards the Omicron variant, it will work better than our previous vaccines, and so there's some confidence that we will be able to induce vaccine-induced immunity.
Thank you, Dr. Abraham. I think you answered all the questions I had. Any questions?
I
for
was
me,
thinking the
Karen?
same thing. No, that was all the things I was thinking myself.
Great. Thank you. Anything else, Solo, to add to that?
Thank you, Madam Chair. At this time, I would like to give an update on the inspectional work that is been done in the town. As of today, we are inspected 18 establishment. Those are re-inspections. Those are food trucks inspections. Those are complaints that Carrie brought to my attention, and the inspector had to follow up with those requests. As of today, we are working with Carrie to make sure that every other complaints, nuisance complaints, restaurants inspection requests is being met. We will be in the process of hiring a regional environmental inspector in the next week or 2. I'm in the process of finalizing my recommendation to HR to start the onboarding of the staff. I would also like to add, part of the work we're doing in the Alliance is looking at how can we enhance our capacity in the Alliance towns. So with us this morning is Ms. Karina Scott, who will be the new shared service coordinator. Her role will be working with the 3 Alliance towns around looking at our strategic planning process, looking at developing SOPs, and looking at workforce development, but also looking at other initiatives on how we can grow our work in the Alliance town moving forward.
Great, thank you.
Thank you.
Any other items? To review and discuss Central Mass Regional Public Health Alliance updates?
That was it.
That was it? Okay.
Yes.
So now it's time to review our meeting schedule.
I'll be unavailable on September 15th. I'll be on vacation that week of the 11th.
Good for you.
Thank you.
Let's see here. What about the following Friday?
22nd?
Yes.
That works for me.
Works for me.
All right, so let's do Friday, the 22nd.
Okay.
Sure.
Do I have a motion to adjourn?
So moved?
Second.
Do we vote on this one?
No.
Oh, yes.
Oh,
So,
yes. Aye.
Yep.
Karen?
Aye.
Jenny? Aye. So adjourned. Thank you.
Bye, everyone.